Welcome to an AAHRPP educational session on applying for accreditation. AAHRPP offers a day-long workshop at our annual conference on how to apply for accreditation. In 2020, because of the COVID-19 public health emergency, we are providing this pre-conference workshop through a series of videos. In recognition of these unusual circumstances, we are providing these videos free as a resource to the community. We're extremely grateful for our presenters from the conference who were excited to move forward and provide education through videos. We thank all of them for generously devoting their time and extensive experience. I will now turn it over to Sana Shakur from the University of Michigan and Joshua Fedewa from the University of Texas Southwestern Medical Center at Dallas.
Thank you, Robert. And I have nothing to disclose in relation to this activity today. These are the objectives for today's session, and in my portion of the presentation, I will cover the first two, and Josh will cover the last two. If you are preparing for your site visit, that means that you already assessed your program and successfully completed steps 1 and 2, where you describe in writing how your program meets the AAHRPP standards. So what is the purpose of the AAHRPP site visit? The site visit is an on-site evaluation of your program, where AAHRPP gets to actually evaluate whether you're doing what you said you do in your application and how you do that. It's important to keep in mind that this is a peer review process. The site visitors are experts in the field from peer institutions that are AAHRPP accredited. And they're there as fact finders who will make observations based on objective criteria. By comparing what should be there, which is what you described in your application, versus what is there, which is information that they will collect from interviews and record review. Is there a gap between the two? And what is the significance of that? So that's what they will report back to AAHRPP, and that's what you will see in your draft site visit report. Preparing for and organizing an AAHRPP site visit is a huge project. So prepare well and start early. Right after the step 1 submission, put together a team to manage communications, training, scheduling, and logistics related to the site visit. And it's critical that throughout this process, you engage your internal research community within your institution. So why is it important to engage the entire research community within your institution and not just focus on individuals that are selected for the site visit? A number of reasons. One, it's important to remember that AAHRPP accredits the whole institution and not just the IRB. Also, this is about protection of research participants, which is everyone's responsibility, from the institutional official to research staff. And you want to present a well-integrated program. Lastly, the accreditation process is an opportunity to remind the research community of the AAHRPP role and disseminate any policy changes and improvements that were made during the self-assessment. So this is truly an opportunity to re-educate your research community and further promote a culture of quality and ethics. So use this opportunity well. And don't wait until the site visit to do that. You should truly leverage the self-assessment process to engage the various AAHRPP units. When you analyze AAHRPP policies that pertain to different AAHRPP offices, whether that was ancillary review committees or Office of Sponsored Research or clinical trial support offices, have a discussion with them. Remind them of the AAHRPP requirements that pertain to their office, even if you're already accredited and there hasn't been much change to those specific requirements. It's always good to revisit. At the very least, AAHRPP units and leadership should be aware that you're going through the self-assessment, should provide input on any changes, and should be familiar with the accreditation timeline. To achieve this, you should have a good communication plan. Outline your communications plan, keeping your audiences in mind. Determine the channels on which you need to deliver your messages, and decide who is responsible for delivering the messages. Also consider the timing of the different messages. Some of the communication strategies that worked well for us in the past include launching a dedicated web page where you can post various educational materials and details related to the site visit and contact information if people have questions. Also distributing flyers across different units once you have a site visit date, and sending out messages through various newsletter articles. In-person presentations are probably the most effective way to get the message across, but try to take advantage of existing meetings and educational forums, whether it's committee meetings, faculty meetings, or study coordinator educational forums, because the last thing people need is to attend an additional meeting to hear about this process. Town hall meetings could also be effective if led by institutional officials. So in short, you have to be creative and think about different ways that you can get the message across and keep this on everyone's radar.
Mm-hmm.
Effective communications take a lot of coordination and planning, and really thinking through who needs to know what and when and how much. And that ranges from broad communication through a website and newsletter articles to one-on-one communications with selected interviewees. The closer you are in time to the site visit, the more targeted your messaging should be. Getting selected for an interview could be stressful for some people. So it's really helpful to have training and interview prep sessions, just to provide them with context, help people understand what this exercise is all about, describe the site visit process and set expectations. But the idea here is to help people feel prepared without coaching them. These sessions are best done in person or even in one-on-one sessions if you have the resources to do that. Ideally, individuals who are selected for group interviews should train with the same group that they will interview with. If you're in a big institution, these individuals may not even know each other, and you want them to be as comfortable as possible during the interview. So it's always helpful to know who will be interviewing with you. Some of the topics that you may want to cover during these sessions include re-review of the AAHRPP structure, reminding interviewees who your institutional official is. Don't assume that people know that. Also tell them a little bit about the AAHRP organization. If you're already accredited, tell them about your institution's history with accreditation. And remind them of the AAHRP requirements that pertain to their specific role. Also review the accreditation process and logistics and help them understand how their interview fits within that whole process. And if you have that information, familiarize them with the site visitor's background. So of course, there's only so much you can cover in 30 minutes or 1 hour session. So to maximize your time during these in-person sessions, it's best to put these materials in writing and send them to people before your in-person session to review them. Also, it doesn't hurt to give people general tips that apply to any interview session. Be on time, be honest and authentic with your answers. Don't hesitate to clarify questions or terms if needed. And also be mindful when using institution-specific terms and acronyms. Different institutions use different short speak to refer to reportable events or to their electronic systems. So just remind them that the site visitors may not be familiar with institution-specific terms. About 2 months in advance of the site visit, the AAHRP staff will share with you a draft agenda. Make sure you have a dedicated scheduling person because you will have a lot of back and forth with the AAHRP staff as well as with interviewees within your institution. Promptly review the agenda and verify people's availability for the indicated time. And let AAHRP know if a selected person is no longer in the position being interviewed, or if you have any questions or concerns about the selected interviewees. Is there a key personnel that you think should be interviewed but wasn't selected? Or do you feel that someone may have been selected by mistake, like Director of Compliance versus Director of Research Compliance? So have those conversations with the AAHRP staff. Also, it's important to let AAHRP know if any of the interviewees, especially physicians, are not available due to clinical duties that could not be rescheduled. Clarify where you have flexibility to move things around in the agenda. There are certain sessions that may not be moved, like opening and closing sessions or executive sessions, but you may move a block of interviewees as long as you keep the groups together. So it's important to clarify what can and cannot be changed within the draft agenda with your AAHRPP staff. Again, organization is key to a successful site visit. Give interviewees clear instructions and be specific. Details are not unimportant. Let them know, do they need to have their picture ID with them? Let them know who to call in case of a last-minute emergency. Ask people to provide you with their contact information. And it's really good to have registration table for sign-in and sign-out process, and plan to usher people to the conference rooms. Some of the interviewees may not be familiar with the building where the site visit is happening, and you may have multiple interview sessions happening at the same time. Also plan to debrief with your interviewees. Most people want to share how their interview went, and that also offers you with an opportunity to identify any issues that may need additional clarification with the site visitors. And if nothing else, that will give you a chance to thank interviewees for doing this service to the institution. In addition to scheduling and training, there are a number of logistical issues that you need to consider. You will need a home conference room for the site visitors where they can do the record review and executive sessions. And this room should be reserved for the entire time of the site visit. Also have a designated point person that can fulfill site visitors' requests. They may need additional documents or they may need to make copies. Have IT backup support, both for system access as well as for video conferencing, and those are usually two different people. If your site visit is happening virtually, please refer to AAHRPP's FAQs about remote site visits. After all, this is your opportunity to showcase your program, and an organized site visit reflects an organized AAHRPP. And with that, I will turn it over to Josh.
Thank you, Sana. So my name is Joshua Fidua, and I'm from the University of Texas Southwestern Medical Center, and I have no conflicts or relationships with regard to this activity. So with where we left off with Sana, we're now moving into the actual site visit. And it's key to remember that what the site visitors are coming into your institution to do is to confirm that what you've said you do in your step 1 and step 2 applications matches the actual practices. And they're going to do that by talking to key representatives of your institutional AAHRPP. You can go and look at who you've submitted as your key personnel in section H of your step 2 application. That will include people like your institutional official, your director of sponsored programs, or whoever's in charge of the money for research at your institution, COI officer, if that is a separate role from the AAHRPP. The key personnel will also include any of the investigators who are listed on the active studies that you've submitted, and they'll also include some of the staff. However, you're not going to be giving those names directly to AAHRPP. You're just going to be providing the names of the investigators. And again, like I said, those interviews with these key personnel are going to allow the AAHRPP site visitors to confirm that what you've said you do in policy is consistent with your practice, and not just within the IRB or AAHRPP office, but across the entire institution. So between these interviews or any of the record reviews, the site visitors may ask you questions or share comments. And at the end of each day, the site visitors will bring in whoever is involved in the site visit process for a closeout session. And generally, these closeout sessions are going to have these site visitors asking you clarifying questions to confirm information that they may have heard or information that they may have seen during their interviews or record reviews. They may ask for additional resources. It never fails that if you've been involved in a site visit or you will be involved in a site visit, that AAHRPP will have chosen a record of the one time that you might have made a minor mistake, and your site visitors will want to confirm that that mistake is not something that you're always making. And they'll certainly give you opportunities to prove that you do whatever process you've outlined in the correct manner. And it's really important as you're in those closeout sessions to take really good notes. At this point, the site visitors are not going to be sharing actual observations, but it could be a preview into the closeout session. I like to think of these closeout sessions at the end of each day as a sort of forewarning of the sorts of things that the site visitors are seeing as opportunities for improvement. And that's really key, is that as you're in any of these interactions with the site visitors, you really need to make sure that you're not getting defensive in any of the conversations, and that you're really welcoming any comments or questions as ways to look at your institution from a different perspective to improve it so that you're continuing to protect human research participants. It's also key to remember that no site visit or site visitor are going to be exactly the same. Each time you have a site visit, the site visitors will most likely be very different. And as you have those unique site visitors, they will run the site visit according to their own experiences and their own preferences. So with that, some site visitors may offer suggestions throughout the day. They may say, well, this is how my institution runs this process. This is how my institution documents things within the minutes. However, others will certainly hold their suggestions and comments. There are some site visitors that are going to view their time with you as an official site visitor capacity. And at the end, after the end of the site visit, they may say, I'm now going to take off my site visitor hat and we can talk as colleagues. And that's really important to remember. The site visitors are chosen by AAHRPP because they come from other institutions who are conducting high quality research. They have been doing this work for some time, and they know how to do this work both to protect participants and to meet regulatory and AAHRPP standards. They are certainly colleagues and resources, and you should definitely try to work with them and find out ways that you can improve your own HRPP. As we've moved through this site visit, you're now going into the official closeout of the site visit. And as you're thinking about that closeout session, consider who needs to be in that room. And this is, again, a place where you can go back to some of the end of day session feedback. Are you hearing any information about the contracts? Are you hearing information about conflicts of interest, or potentially how the coordinators at your institution are conducting informed consent processes? That will inform who you may need to have in the room to hear this feedback from the site visitors. It's key to remember that any comments delivered at this session are only observations and not official areas of concern. The site visitors are going to return and go to the AAHRPP staff and inform them of everything that they found while they were at your institution. And they'll let AAHRPP know what they think should be the areas of concern. However, this will be reviewed by AAHRPP, and some of the information that you're seeing during the closeout session may or may not come in your official draft site visit report. As you're going through this closeout session, make sure that you're taking really good notes and asking as many questions as you feel necessary. And I would consider using the blank AAHRPP element document for note-taking. This has all of the different AAHRPP elements in the left-hand column. On the right-hand side, it has blank information. The AAHRPP site visitors will deliver their observations on an element by element basis. And this allows you to take really good notes at the end of this closeout session, and then go back to the actual AAHRPP element and any information that might be available on AAHRPP's website relating to that element to look at potentially ways that you could further address those AAHRPP elements. So now we have closed out the site visit, and I think it's really important that you celebrate. You've come really far. But at the same time, don't celebrate too much. If you've ever watched any sort of sports team win their championship in whatever sport you're looking at, a lot of them will say, we're going to celebrate today and tomorrow we're getting right back to work. And that's really important with this AAHRPP process as well. It's important to remember how far you've come. As Sana indicated when she first started, you've gotten through step 1, you've gotten through step 2, and now at this point you've gotten through the site visit, but you still have a little bit more work to do. So as you're going into preparing for the draft site visit report, review notes from the closeout session and go back and look at the AAHRPP elements, look at resources on the AAHRPP website. It's very important to do this because timeliness is key at this point. If the AAHRPP site visitors found information and potential observations in areas of concern that may require significant changes, those cannot be made overnight. And the other thing to remember is that some of these changes that you may need to make could include parties that are not necessarily in your AAHRPP or IRB office, and you may need to collaborate closely with other institutions, other parts of your institution, or just people that you haven't necessarily involved in the AAHRPP process up to this point. So the draft site visit report will arrive from AAHRPP about 20 days from the site visit. And as I said, some of the information that you heard as observations from the AAHRPP site visitors may not come back as official areas of concern in the actual draft site visit report. So it's really important to look at the draft site visit report and confirm that what you've started working on is actually what you need to work on. So each site must respond to each area of concern. So it's not required per AAHRPP, but I would recommend, again, using the draft site visit report as a template for responding. It allows you to very clearly delineate what changes are made in relation to each area of concern, along with any potential documents that you've revised, any memos or other supporting documentation that you're using to allow AAHRPP to see that you've addressed the area of concern in a very systematic and organized fashion. As you're going through and responding, you need to include the changes that you've made, any plans for education or training or completed education and training, any plans for monitoring or completed monitoring for that change, and then any supporting documentation that will help show the change, education, training, or monitoring that you're planning on implementing. So again, it cannot be emphasized nearly enough. Start early as you're preparing to respond to the draft site visit report. Communicate. As Sana had said, it's important to communicate as you're leading up to the site visit. And it's very important to continue that communication after you've gotten done with the site visit. So that way you're really engaging parties based on those areas of concern and keeping the institution apprised of what's going on with this whole AAHRPP process. Coordinate as much as possible. Some of the changes that you're going to need to make could be quite complex, especially relating to the changes, the education, any training or monitoring, things that one person may not be able to get done. And you may even need to assign owners or work groups to ensure that each response is completed based on the plan that you've outlined. And you should be treating these areas of concern as opportunities for improvement. These are outside observations of ways that your institution could improve how you're protecting research participants. And these just mean that at the end of the tunnel, your institution will be better for it. So as you're going through and responding, I indicated before that you need to educate or train relevant parties on those trainings or on those changes. And as you're going through, you want to make sure that you're documenting for the education and training the dates of when that's going to be happening, who was informed or present at any of those education or trainings, and how that education or training was delivered. For monitoring, what you'll want to do is make sure that you put in place a plan to ensure that the changes that were implemented continue. And it should be specific to the changes in practice. What you'll want to make sure that you document is any of the parties that will be involved in the monitoring procedures, and if it's necessary, any plans for continuing that monitoring for a distinct period of time. So now we'll move into 3 examples. In this first example, the area of concern that was identified is that the IRB minutes failed to document that quorum was maintained throughout the meeting. And so potential response, and I want to emphasize that these are suggested potential responses. These are certainly not the only ways that you could respond to this area of concern and obtain AAHRPP accreditation. But in this example, the response is that the IRB minutes template was updated to have better attendance records. The education that was delivered is that the IRB staff, any IRB chairs that are involved, and members were educated on the requirements for quorum. The training that was delivered is that the IRB staff who used that minutes template were shown how to use the new template, and then the chairs and members were shown how to review the completed minutes or the draft minutes for attendance records. And as part of the monitoring plan, the IRB director confirms that the finalized minutes meet the expectations and documents those reviews in real time. In the second example, the area of concern that was identified is that the policy procedure manual fails to define a pathway for IRB members to report any potential undue influence on how they are voting during IRB meetings. So the potential response here is that the policy procedure manual was revised to include the reporting pathway. The education that was delivered is that IRB staff, the chairs and members were educated on this new policy. In this particular example, I'm suggesting that training is not necessarily applicable. And as you're potentially looking at some of these examples, training may not be applicable, monitoring may not be applicable, but you'll still want to make sure you document why you think it's not applicable. The monitoring that you potentially could implement for this second example is that the IRB members confirm in their yearly self-evaluation that they know whom to report undue influence to. And the third example is that the contracts failed to include an AAHRPP element. So the potential response is that the contract templates were updated to include all AAHRPP elements. The education that was delivered, it was to the internal research community, any contract specialists involved in your sponsored programs office, or really just anybody who's engaged in negotiations for these research contracts were informed of the change to the templates. The training that was delivered is that those involved in negotiations were trained on AAHRPP elements and appropriate variations. And the monitoring that was implemented is that the SPA director or whoever's in charge of these contracts reviewed finalized contracts on a bi-weekly basis and documents that the AAHRPP elements were present or potentially good reasons for exclusion. Thank you so much.
Thank you to Joshua and Sana. We really appreciate your excellent support for human participant protections and AAHRPP during this difficult time. This concludes this presentation, but please check our website for other videos in our pre-conference series on applying for accreditation.